this is Jennifer Hesser. Thank you for joining me today. Today we're going to talk about B-D reversals. So when kids are young and they're first learning their letters, they have a lot of difficulty with B's and D's. Some kids also have difficulties with their P's and their Q's because they look so similar. Even fewer kids, though, have difficulties with U and N because they are actually the same shape, just inverted. But B and D by far is the most common. And the reason that they have B&D reversals is because B and D look so similar. And so I've always used an analogy. I call it Mary-Kate and Ashley syndrome. And if you're familiar with Mary-Kate and Ashley, or those twins that are all over People magazine, they used to be in Full House. Well, they're twins and they look exactly alike. And when people refer to them, they call them Mary-Kate and Ashley because they don't know which one's which. So that's what happens with B and D. They don't know which one's which because they're visually confusing. It's not that they don't understand what the sound is, because they don't say my mom and Bab. They know it's my mom and dad, but because they're so confused with the shape and they look so similar that they have a problem with it. So the only way to really fix a BD reversal is to spend a lot of time with Mary-Kate and Ashley. So if you need to learn the difference between B and D, you're going to have to learn that they're produced differently. The B is B and the D is D. So the B, your lips come together and they pop, B. And the D, your tongue taps behind your teeth, D, D, D. So if they say dad and they can feel that they're not saying Bab, then they'll have a better shot of using the right one, okay? Because they're anchoring to that. The other tricks that we use is we talk about, your B and your D. You can make the B and the D. We also have our hand tattoos that are called dabboos. And one is a bumblebee, and the wings go up your finger, and that's the B sound, and the D sound is a dog, and the tail goes up your finger, so that it stays on a child's hands for several days. It's about the intensity of the exposure to those sounds that are going to make a difference. You want them to see it more. So most things, when they need change, it's going to be about frequency, intensity, and duration. If I want to become a professional golfer, I would have to up the frequency of my lessons, the duration of my lessons, and the intensity of my lessons. So the best way to fix the B's and the D's is to do some drills with them, have them hold their fingers up, put the tattoos on multiple times, have them hold up a B, have them hold up a D, get them to practice. If you're interested in finding out more about the dabboos, which are the B and D hand tattoos, you can check out our website at KendoreLearning.com. We also have a really great little song and video that goes along with it for the young ones that you can find on our YouTube channel. Thank you so much.